Okay, my report was based on oppositional defiance disorder. My name is Whitney Sponsel. I am a fourth grade general education teacher. For the introduction, just looking at what is oppositional defiance disorder. According to the mayoclinic.org, oppositional defiance disorder is a childhood mental health disorder that includes frequent and persistent anger, irritability, arguing, defiance, or vindictiveness. The behavior lasts 6 months or more. The behavior is much more severe than that you would see from their typical peers. Sometimes some of those behaviors can be seen in most of the kids at their age, but for somebody to have oppositional defiance disorder, you would see their behavior as a lot more severe than what you may see in your average child. For what are the causes, there really are no clear causes for oppositional defiance disorder. There are some factors that might contribute to it, such as like genetics, just the way that the brain is wired. It could also be like an environmental factor, such as lack of supervision, overly harsh punishments, child abuse, or neglect. For the history of oppositional defiance disorder, it was first noted as a disorder in 1980. Since then, there have been many questions and debates over the exact definition of oppositional defiance disorder and how it relates to conduct disorder. Throughout the years, they've made several revisions just to try to clear up any misconceptions that there might be. The disorder is now noted as being both behavioral and emotional. Today, there are still questions regarding the definition and the rate of diagnosis. And it can be a little bit tricky just because some of those behaviors are things that you see in typical children, but they do continue to note that the behaviors for oppositional defiance disorder will be more severe. They may also see kids with oppositional defiance disorder will have other diagnoses as well, such as ADHD, anxiety, as well as mood disorders. Some symptoms of oppositional defiance disorder in elementary, middle, and high school. It can show up as early as preschool age. Typically, kids are diagnosed and their behaviors are seen in the ages from 6 to 8. There are a variety of symptoms with kids who do have ODD. They can be uncooperative, defiant. Again, they can be vindictive towards others. But with oppositional defiance disorder, they aren't violent towards others. Whereas in conduct disorder, they may see more violence towards others. And also, the diagnosis must be done by someone who is a mental health expert. So some of the helping skills to help students with ODD, I think just listening, as a teacher, just really listening to the student, talking with them, trying to find out what's really going on, what's triggering their behavior, what's causing them to feel the way that they're feeling. They also have strategic interventions for the power hierarchies, implementing an intervention to look at the way their behavior is being reinforced and encouraged. So also looking as a teacher, am I reinforcing their behavior? What are they getting out of the behavior that is causing them to continue the behavior? And also just being willing to look at that as well. Encouragement, encourage positive behaviors. Things like sending a note home, even if it's just a small gain, to just really help reinforce and encourage positives. Other ways to support these students, they may need to try different types of therapies. There's peer group therapy, family therapy, cognitive behavioral therapy, and in some cases, medications to help. one of the options is offering choices, giving them the option of you can do this or you can do that, and then walking away and giving them that time to process their decision, and hopefully they'll be able to make the right decision through that. Building connections in relationships. If you have a good relationship with a student, hopefully you will be able to identify when the behavior is beginning before it gets out of control. And then again, just really getting to the bottom or to the root of the behavior, figure out what's going on, pay close attention to the student's body language when the behavior begins to flare up, being aware and seeing those clues can help the teacher to address the issue before it becomes a major issue and a major problem in the classroom. Working with parents and other staff members, I think that communication is key, and communication is huge when you're working with other people. A child who does have ODD will likely need early interventions, and hopefully that will help them to prevent, future problems. It is important to talk to parents about, what concerns you have in the classroom. Also possibly working with the school counselor and making parents aware, and seeing if a counselor can work with them as well to help build those social skills. If the child is already diagnosed, it is important to communicate expectations and having a plan of action in the classroom, and making sure parents and other staff members are aware of your plan of action so they can help support that as well. For a hypothetical story, a student in 4th grade has recently been diagnosed with oppositional defiance disorder. He frequently argues about his work in class and often refuses to complete it. At times, he can become jealous of the other students in class when they receive attention from the teacher or the class para. He will speak harshly towards the other students. When he becomes upset, he will refuse to follow class rules and usually ends up needing to go with an administrator. So through this story, we'll look at how can we help the student. As the teacher, we can use positive reinforcement and possible modification of assignments. If the assignments are causing the student to feel overwhelmed and feeling like those negative emotions, like they aren't able to complete it, modifying that assignment to something that they can complete, maybe starting small and working their way up to being able to complete grade level assignments, giving praise even for small accomplishments, building rapport with the student. Just building those relationships with kids is pretty powerful. And also being able to listen to the student, using that helping skill to find out, what's going on when they are having the problem, reframing. When a student is talking to you and explaining how they feel, maybe reframing their thoughts into a more positive or productive feeling. Reflecting the feelings as a teacher. If a student is sharing their feelings and their emotions and letting you know how they're feeling about a certain thing, reflecting what they say in a way that communicates that you understand and have empathy towards what they're going through. I think that, the teacher, again, just examining their own behavior to make sure that we aren't doing anything to contribute to the problem. If they're wanting a reaction from us and they're getting a reaction from the teacher, maybe finding a better way to solve that problem. As well as contacting the school counselor. My school has a school counselor there full-time, so if she is able to work with a parent and a student and have regular time with that student, she can develop that relationship with the student as well as helping them with social skills and relationships. So in conclusion, oppositional defiance disorder, or ODD, it is a mental health disorder that doesn't really have a specific cause, and there really is no cure, but we can do things to help the student with that diagnosis. What we can do as teachers is support the student by building a relationship, getting to know the child, being able to identify what is triggering that behavior, as well as seeking help from counselors. Communication is key when working with other staff members and parents to better understand the child and our approach to helping them.